Hello and welcome to the program. My name is Marie Yambo. As usual, our social media handles at Marie Yambo at KBC Channel 1 on Twitter, KBC Channel 1 TV on Facebook. Now, universal health coverage means providing healthcare to the people when and where they need it without financial hardships. Now, community health is integral to achieving universal health coverage, and one community in Lwala Migori County is leading the way. The establishment of the Lwala Community Hospital has not just ensured that the people access healthcare, but it has also improved health outcomes in that community. To speak to us about this community-led initiative is none other than Julius Mbeya. He is the CEO, Lwala Community Alliance. Welcome to the program.
Thank you so much for having me.
Asante sana for coming to our show. And maybe first things first of all, how did the Lwala Community Health Alliance come about?
Lwala was founded by the community of Lwala. Lwala is in Rongo sub-county in Migori, southwestern Kenya. And we were founded by a community that believed that it was unjust and unfair not to receive good quality care. As a result, the community self-organized, bringing together the resources that they had to create the area's first clinic, the Lwala Community Health Center. That clinic was created 15 years ago. The community contributed and donated land, their labor, and with the help of others, they created this hospital that is now seeing about 70,000 patient visits a year.
Mm-hmm. Yeah. And just like you've rightly put it, the community realized the need to have a hospital around, for them to be able to, access healthcare and all that. But was there an issue within the community that really pushed them to say, like, we really need to have this a hospital here?
Yeah, we know that in that period, southwestern Kenya or western Kenya is one of the areas that was worst hit by the HIV pandemic. And at a time when care was very inaccessible, it means that many people were losing their lives. But also this community was very distant from the nearest health center, walking 15 or so kilometers away. So if a woman was in labor and they had gone to see a traditional birth attendant and labor became complicated, they would be put on the next available transport, which would either be a wheelbarrow or an ox cart, and then be taken to the nearest road, hoping that you would get transport from there onto the health facility. And that meant that a number of lives were lost in the process. And so the community saw the challenge and took it upon themselves, knowing that it is in their own way, in their own right, to be able to address this challenge that they were facing. And so healthcare and setting a health center was one of those priorities that they set their eyes on. Yeah.
And definitely with the help of members of the community, the two doctors, who were coming from the same community, so they were able to, establish this particular hospital.
Our founders, Dr. Milton and Fred Ochieng, were students in the university at the time that the initiative was being started. And so having come from that community and having had the luck to get a scholarship, one of the things that the community did also that led to this is that they contributed also for their air tickets to be able to take up this scholarship that they had gotten in the US. And as they were releasing their sons, they are called Sons of Lwala, one charge that they gave them was that do not forget us when you get there. So top on their mind really was looking back and seeing the community that they had come from. And so as students, students in college hallways, these are first, second year students. We're not talking about people who have graduated college or otherwise, got together with their community in this effort. And so very early on, getting their father and their mother as members of the committee that put together this initiative, and starting to fundraise out there with their friends and others to help the community back home. Unfortunately, before the groundbreaking happened, they lost both of their parents to the HIV pandemic, both first the mother and then the father. But they took this as a call to action, really to honor their parents' dream. So the whole founding of the hospital is confounding factors, the community experiencing these challenges, Fred and Milton experiencing loss in their own lives, but also really being inspired that actually subsequent generations can be different. You've talked about how we continue to engage community in that. We see lots of things in Kenya where communities get together, they start something, and then somehow it fizzles out of the way. That is why community engagement becomes very important. One of the things that we have maintained is that the original founding community still is very involved with the running of the hospital, providing oversight and ensuring that their voices and their interests are still being catered for, even as the organization has grown.
Okay, so maybe let's now delve into the nitty-gritty of the services provided, and let's start by you explaining to us how has this community-led initiative impacted on women, children, healthcare outcomes?
Our main focus is women and children, and the big things that we've tried to fight as a country for many years is reduction of maternal deaths and reduction of under 5 mortality. What Lwala does is actually to deploy community-led initiatives that actually address that. So it is not just hospital-based care, but also preventive care at the community level using community health workers. So what we do is to measure and double down on prevention. So because we know that by prevention you are actually able to address some of the things that would come out later. And so we have a program that community health workers identify women at the point of, as soon as they become pregnant, and then link them to the health facility so that they can be able to be attending antenatal care. They walk through with them, ensuring that they deliver at a health clinic, and then follow the child until the child is 5 years. As a result of that, we have been able to see very dramatic outcomes in under 5 and maternal deaths. So, maternal death is complex to measure, but you can look at it in terms of how many deaths are you recording at the health facility. How many women are delivering at a health facility in a safe environment? Because if you increase skilled delivery rates, then the number of women that are dying comes down. So in Lwala, for example, over 99% of women deliver at a health clinic. So we've dealt with the problem of home-based deliveries. And we also, as a result of following these children, we see many and many more women completing their antenatal care, 4 visits at least before birth. We see children receiving their immunization and completing those immunizations. And as a result, we have evidence to show that we have dramatically reduced under 5 deaths and maternal deaths in the area.
How has the community embraced community health promoters? Because sometimes there is this notion that they are not doctors, they're not well trained. How has that come?
Yeah, community health workers or community health promoters are, yes, your auntie, your mother, your neighbor, but the most important thing is that there are people who come from that community and they understand the needs of that community. Kenya, for a long time, has had this cadre. However, the problem that there is what you have mentioned, that they are not equipped, they are not trained to be able to do the work that we expect them to do. What Lwala does together with the Ministry of Health is that we ensure that these promoters are trained. Beyond training, we ensure that they are equipped with the tools they need. For example, if they are to go and check if a child has malnutrition, they have the tools to be able to do that. They can have a MOAC tape which is measuring the upper arm circumference of a child, and based on the age and the type, they can know whether this child is malnourished or not. Simple tools like that. In other areas, they are able to test for malaria, at home, and to be able to give initial treatment for that. So by equipping them, giving them the tools that they need to work with, and more importantly, paying them, that is what changes things, because then we come to realize that this is legitimate work that is being done and it's contributing to the health outcomes that we are seeing. And then more recently is digitization, which means that even the work that they are doing, that work is captured using digital tools, and the data is available for the health system too.
How integral community healthcare initiatives, including the CHPs, how important and their role is to ensure not just the health of the community, but that as this particular administration is actually pushing for UHC.
Yeah, right. You observe rightly that community health, actually Kenya as a country has recognized community health as the surest vehicle, or primary health care as the vehicle for achieving UHC. And that means that we are recognizing that if you do investments at community level, you are able to reduce things that would happen at the higher levels of the health system. This is why even the president's commitment in investing in CHPs, or community health promoters, is so vital, because this is the message that we've been passing over the years. When Lwala started those 15 years ago, about 2012, about 6 or 7 years ago, we recognized the importance of incorporating the community element into healthcare delivery, and built a system that incorporated those who are giving births at home, the traditional birth attendants, because if women are not delivering at the health clinic, who is giving them the services? It is the traditional birth attendant. Then we recognize that government already had a cadre of community health workers, or community health volunteers as they used to be called, that were not professionalized. So our input was to say, how do you transform this workforce into a workforce that can actually transform the lives of people? And so this is how we started this community health worker program that now is reaching across Migori County. And what we do, like I said earlier, is number one, identification, ensuring that these are people who are selected by the community themselves. The community health strategy says that the CHPs should be selected from their own community, known by the people that they are supposed to be serving. And that is why you cannot take a community health worker from Nairobi to go and work in Nakuru. No, it doesn't work like that. It has to be from that very community. Once you have properly identified them, how do you train them? There is a national curriculum that is available for training of community health workers, ensuring that not just in Migori, but countrywide, all the 100,000 community health workers are trained on this curriculum. There is the digital tools that they are supposed to be using. Right now, as a country, we are using what is called the Electronic Community Health Information System. That system, the mobile phones and the devices need to be available for these community health workers, so that the data that they are collecting can get to the national level. And more critically, equipment. That's why you've heard the president say that he will provide community health worker kits. Those kits are important because they are the tools that the community health workers use. And finally, payment, ensuring that they receive payment for the work that they are doing, whether it's a stipend paid on a monthly basis, but consistently ensuring that that labor is actually paid for. And finally, none of us works without supervision. So how do we ensure that these community health workers are supervised? And there is a cadre that is called community health assistants or community health officers. These are the supervisors that should be there to support community health workers in the delivery of their health services. So Lwala works through that system, recognizing that if we build that at community level, you are not only increasing access to healthcare, but you are also dealing with things that could have been complications that could be avoided further along the way. So community health workers are doing all this effort to mobilize women to get them to the health facility. The woman is doing everything possible to ensure that they go for antenatal care, completing at least 4, 5, some go up to 8 visits before delivery. The community health worker is ensuring that they are delivering at the health clinic. Now, things can go wrong at the health clinic, not because of the wish of the healthcare worker or anything, but we do know that one of the leading causes of deaths of women at the health facility level is hemorrhage, which is bleeding after birth. And there are many initiatives that have been developed to help address this. What we do is that we have what we call a PPH bundle, postpartum hemorrhage bundle. This bundle brings together different interventions for dealing with a woman when they are bleeding after birth. There are medicines there, like oxytocin, there's something called TXA, carbetocin, and others. But there are also other tools like uterine balloon tamponade. This is something that healthcare workers can insert into the woman and help when the uterus has collapsed. But there is also something we call non-pneumatic anti-shock garment. This again is an initiative or an innovation that Lwala has helped bring into the country that is helping also healthcare workers to deal with women when they are hemorrhaging. So what we do is to avail all this raft of commodities together in the bundle, and that healthcare workers are trained on them and can be able to respond when there is a problem that they are dealing with. Yeah.
And then there's the issue of finances when it comes to providing healthcare services. Yeah. How do you manage that?
Lwala has predominantly relied on donor funding, and I think it's a very good question you raise around funding, because financing for health is such a major challenge. As a country, we have not reached the targets that we've signed up to. There is something called the Abuja Declaration, which requires African countries to spend at least 15% of their budgets on health. We are very far away from that. And much as, yes, we have health as a devolved function and all that, still financing for health is very low. And we spend about $5 per person per year. In places like the US, they spend $5,000 per person per year. So when you are looking at how much we are spending in health, it's still very low. So yes, we've been relying on donor funding, but also we are grateful for the commitments that government is making and has made, because the work we are doing is not only relying on the Lwala Hospital. We are supporting about another 160 health facilities across Migori County, and those facilities are government health facilities that are run by the county government at that level. So other than the funding that comes from development partners, there is also the government's contribution. And what I'm saying is that if we can up that contribution, we can actually be able to be in a better place to be able to provide this care for the long term. And now that you're asking about financing, and what we are thinking about it is that we are also concerned about the future of our hospital, because we know that donor priorities shift, and much as we have had our partners work with us for the last 15 years, we are also thinking about a future where these partners would not be there.
Yeah,
and that's
so
why...
You're talking about the sustainability
Yes,
of this.
This is the sustainability question for us. And for us, because the service is serving a segment of the population that is not very endowed, these are local farmers, and we are relying on things like enrollment of communities into NHIF, so that can provide a revenue source for the hospital. But even more longer term is that for us to be able to continue providing this care at the level where we are providing it, which is almost nothing, we have to raise money. We are now building what we are calling an endowment for the hospital. And the idea is that we can have a pool of money that we invest, and out of that investment, the profits that come from that investment can continue to run the hospital. Because our desire is that the dream that our founders, Fred and Milton, had, and the community had, of providing healthcare is not just for the time they are living. They want this thing to be available to their children and their children's children. And so for that reason, we are believing that by building this endowment, we can be able to provide this care in perpetuity, so to say.
Oh, okay. And I know we've talked about, what the hospital is doing to the community and all that. But I would also want to take this opportunity, maybe you take this opportunity to just speak to the people, number one, because you can set up a facility. If the people are not receptive, then you don't achieve what you need to achieve. You can have the community health promoters, but the community plays an integral role. And this message is not just for the Lwala community or Migori County. What message do you have for Kenyans? Because look at it, we are in an urban setup. We are in Nairobi now. And I can access health facilities as you know, the shortest distance. I have a variety, so to speak. How important is the community engagement or community support in as far as, number one, achieving community health, and number two, their role in achieving UHC?
You know, I would take the motto that we have at the Division of Community Health. It says, Afya letu jukumu letu, which tells you that health starts with the individual. What the community health tries to do is to make these choices more available to people and more known to people so that people can make the right choices. Community health promoters are very effective in influencing behaviors at the household level, you know, telling families this is what we are supposed to do, here is where we are supposed to go for care. So starting with the individual and then helping individuals to make those choices, and then increasing access, both in terms of access, in terms of distance, but bridging that also with the services that are offered by community health promoters. That is what is going to take us to that next level. And more importantly, prevention is better than cure. Yes. I think that is been known for generations, and I think shifting our spending in health to focus more in prevention instead of waiting to cure can actually take us to achieving our SDG targets.
Okay. Last but not least, what would be your word to the county government, especially because health is devolved, and all this you're doing, helping the community cannot be done without, the county governments coming on board and supporting you. And definitely the benefits of community health, like you said, if we arrest it at the community level, then we save a lot at the other levels. So maybe what would you want the counties to do? I know they're doing a lot, but yes.
I think it's to recognize that of all the devolved functions, health is the most critical, and to do everything possible to be able to invest in health and increase investments in health. And so for that reason, I think just ensuring that in our budgets, in our planning, that we prioritize health and prioritize community health and link up with the national government in making some of these promises we have made to community health workers possible. Let's digitize them, let's equip them, and let's pay them. And by doing so, we can be able to transform the health of this country.
Okay. Thank you so much, Julius. Whenever we start, it's almost like we have a lot of time, but I know we still have a lot to discuss in as far as community health, which I'm really passionate about, because if you cannot address the community at the household level, chances are very high you might not address it at the higher level of healthcare. So we look forward to you coming once again and just sharing with us some of the initiatives you're doing and the progress you're making in as far as community healthcare is concerned. Yes.
Thank you so much.
Asante sana. So thank you also back at home for tuning in, and I hope now you understand what community health promoters do. They are trained, they're able to handle what they're supposed to handle, and the hope is that we will be able to embrace community healthcare as a country so that we can be able to achieve universal health coverage. So thank you once again. My name is Maria, and we hope to see you again next time.